Namaste, I am Dr. Srinivas Juluri, Senior Surgical Oncologist, HIPEC and Robotic Surgeon, Hyderabad. So, September month is observed as Ovarian Cancer Awareness Month in the whole world. The reason is, this is a not so very common cancer, specifically seen only in women, but at the same time, it takes a large number of lives in the whole world. More than 1 million people lose their life to this particular cancer in the whole world. In India alone, more than 40,000 people have lost their life in the year 2024. That is what we know of. Unknown to us, many women succumb to this disease, even undiagnosed. Very unfortunate situation about this ovarian cancer is, there are no specific symptoms. Patients present to us with very non-specific complaints like tummy fullness, dyspepsia, acidity, unable to digest food, or feeling satiety after a very small meal, or losing weight. These non-specific complaints are the most common things. Sometimes we do find people coming with a complaint that they can feel a big mass in the tummy, but that's a very uncommon situation. So because of these non-specific symptoms, a lot of people get treated in a very general way in the community. Unfortunately, those patients who are having these non-specific complaints, women particularly, if they are not responding to treatment after 2 months, they are supposed to be referred to higher centers or investigated further. During these investigations, we find these cancers. Unfortunately, by the time they reach us, they are in stage 3, in a majority of almost 80% patients. But still, there is very good hope now. Compared to what it was earlier, the technology to treat them has improved, chemotherapy drugs have improved, anesthesia techniques have improved, patients' general conditions are getting better with medicines. So in that sense, even with stage 3C, we are able to cure a large number of patients. One good addition to the treatment of ovarian cancer in the recent times is addition of what is called HIPEC therapy. Now HIPEC is called basically hyperthermic intraperitoneal chemotherapy. Now what does it mean? After we remove the visible and palpable disease in the tummy, the whole of the tummy, once we have done the removal, once we have done the surgery, during the same sitting, while the surgery is ongoing, we do what is called high dose, high temperature chemotherapy run through the whole abdomen. Now this particular procedure itself adds almost 20 to 25% extra survivals at the end of 5 years, which is not a small number. So that is how we are able to kind of achieve more and more cures, more and more better quality of life for these women. But what we need to understand is, those non-specific symptoms should not be left alone. They should be investigated further and immediately referred to a higher center for further treatment.